Medical school placements were cancelled due to the COVID-19 crisis, meaning that thousands of medical students missed key aspects of their clinical learning. To address this, I delivered a virtual placement on stroke medicine with the SDocs team at Medics.Academy. This included an acute clerking and virtual ward round. We had 40 students watching live, 34 of whom joined our Slack channel. Typically, on a ward round, I would only have a maximum of 4 students, and if I was on A&E, I'd only keep 2 with me. The virtual ward round reflected 4 real patients on my ward that week. Therefore, students were observing a real-life ward round. We explored patients with hemorrhagic and ischemic stroke and discussed key complications such as aspiration pneumonia and depression. The acute clerking was also a patient I encountered in A&E that week. To ensure this was an engaging session, we communicated via Slack. I would ask the question to the audience, with them responding on Slack. To any one question, I would typically get around 4 to 5 answers. This allowed me to capture the general feeling of the audience and address any incorrect answers. I was surprised by the amount of engagement we had through this medium, with students answering straight away. I wonder if the shield of anonymity helped individuals feel more comfortable to answer. Obvious limitations from this teaching session were the inability for students to physically examine patients and see signs of pathology with their own eyes. Much learning from being a medical student comes from being on the wards and seeing how it works. Nonetheless, this teaching session reached 10 times the number of students I would typically be able to reach, proving that you can scale up a ward round. It allowed me to communicate key learning points from patients on my ward that week, and was overall an engaging and interactive session.